talk to you this morning about understanding the serum free light chain test. A lot of you in the audience probably have had the test, and maybe some of you haven't had the test. This will give you some good information about the test. So the serum free light chain test was introduced in 2001, and it's changed how monoclonal gammopathies, multiple myeloma, and AL amyloidosis are assessed. So multiple myeloma and amyloidosis are both cancers of the plasma cell, and the cancerous plasma cells accumulate in the bone marrow and cause the pathology and symptoms of the disease. These can be low blood counts, anemia, bone damage, abnormally high protein levels in the blood and or urine, increased risks of infection, and in amyloidosis patients, the proteins can deposit on and damage critical organs, for instance the heart or the kidneys, and we can use testing to monitor the disease to guide the therapy. So this shows the bone marrow is inside of the hip bone and all the other bones, and it's a soft blood forming tissue that fills the cavities. And inside the cavities are red blood cells, white blood cells, and the plasma cells, which are the cells that become cancerous. This shows what the difference between the bone marrow in normal versus myeloma patients. In normal bone marrow, there's a variety of different plasma cells producing a whole range of different antibodies and a few light chains. But one of these cells in cancer becomes cancerous and overgrows the whole bone marrow, forming, for instance, an intact Ig myeloma, which produces too many Ig molecules, too many light chains, and both are overproduced, resulting in the pathology of the disease. This is the immunoglobulin or antibody structure. It consists of a heavy chain and a light chain, and you can see that most of the molecule is constant, but up here, these parts of the molecule are variable, and they constitute the binding site of the antibody. And for each patient, they have a unique M protein, and that results in some of the differences you see in the disease. There are different types of light chains, Kappa and Lambda, and there's actually two free light chain assays, one for each of these molecules, one for the Kappa and one for the Lambda. And the Lambdas circulate as dimers, which is important because they're filtered more slowly by the kidney. The free light test measures both types of free light chains. There are other assays that were used before free light, and free light is the other name for the assay besides serum free light chains. So one of the tests is called Serum Protein Electrophoresis and Immunofixation Electrophoresis. These are older assays that were used before serum free light chains were invented. This is a diagram of what SPEP looks like. The proteins are separated by charge and size and visualized by staining. And here you see in a normal patient, the gamma region is a broad band, but kind of lightly stained. But in a patient with myeloma, they have what's called an M spike, where this band is actually very darkly staining, and it has a very high spike. That's why it's called the M spike. Immunofixation electrophoresis is how you figure out what type of myeloma the patient has. For instance, IgG lambda. In the normal patient, you could see this is the same protein stained and electrophoresed here, the total proteins, and then they can be precipitated with antibodies to IgG, IgA, IgM, or the Kappa and Lambda light chains. You can see this person doesn't have an M spike, and there's very diffuse staining normally. But if you have myeloma, you have the M spike, and it stains with IgG in this case, and Lambda, so you know the patient has an IgG Lambda myeloma. So what is the free light chain test, or what are they? It's actually two immunoassays, one for Kappa and one for Lambda immunoglobulin free light chains. Both the Kappa and the Lambda in milligrams per liter and the Kappa to Lambda ratio are useful, and they're more sensitive than SPEP or IFE. This shows how the free light assay works. It's a polyclonal antibody to sequestered light chain epitopes. And an epitope is just a portion of the protein where the antibody binds. So here in the intact molecule, this is a sequestered epitope. But when the light chains are free, the antibody in the assay can bind to this site of the light chain and cause the signal in the assay, and that's how your light chains are detected. Normal ranges have been established for serum-free light chains, and there's two different types of units used, milligrams per liter or milligrams per deciliter. So for Kappa, for instance, if you're using milligrams per liter, it's 3.3 to 19.4 milligrams per liter is the normal range. This is the normal range for Lambda, and then the ratio is 0.26 to 1.65. It doesn't change with the units because the units cancel out. This explains why the units are important. For instance, say in May you get tested in Lab A and you know that your Kappa-free light chain is 38.6 milligrams per deciliter. Then you go to a new lab in July and you see, oh my goodness, it's 303 for your Kappa light chain. But then you have to say, oh, look at the units, milligrams per liters here. And that actually is more like, so you haven't gone up a huge amount. You're actually 385 milligrams per liter here. So you have actually gone down a little bit instead of going up by a huge amount. So do be careful of the units if you change labs. So why is it important to measure free light chains? Well, first, it helps physicians determine your prognosis. It's more sensitive detection of free light chains than SPEP or IFE. It may indicate if your therapy is working earlier than SPEP.